You won't get through med school without knowing the spinal tracts, so let's go through them. Let's start with our sensory ascending tracts. The first you need to know is your posterior dorsal column, conveniently in the posterior part of the cord. And I want you to remember feeling very patient. This is going to help you remember fine touch, vibration, and proprioception, and the feeling very patient is going to help you remember that these ascend up all the way up the cord and wait to decussate at the medulla. Now let's compare that to our other sensory tract, spinal thalamic, and you're going to remember not that patient for non-discriminative touch, temperature, and pain. And the not that patient is going to help you remember that these are going to cross over right away at the anterior commissure and then ascend up the tract. And this is really key to understand because where the tracts decussate is going to help you identify whether the findings are ipsilateral or contralateral based on the level of the lesion. And now for our motor descending tracts, aka corticospinal. These originate in the primary motor cortex, decussate at the medulla, and travel all the way down to synapse on our lower motor neurons to initiate voluntary movement. Now, two easy tricks. Remember that your lateral corticospinal tract supply the limbs versus your anterior corticospinal tract supplies the axial truncal structures. Save this and see you next time.